Obtaining an estimate that is generalizable to relevant study population in a research study is external validity. Any process that tends to produce results that depart systematically from true values in a research study is called a bias. Systematic selection of more number of exposed participants with a higher risk of outcome in a cohort study will result in selection bias. The effect of the exposure exposure of interest on the outcome is distorted because of the effect of extraneous factors that are related to both the exposure and outcome. This phenomenon is called confounding. Biases can occur during which stage of research study? Study design, study implementation, and data analysis. All are true regarding measures to reduce information bias except adequate sample size. Precise operation definition of all variables, detailed measurement protocol, training, certification, and recertification of data collected. Variability in estimation due to unknown or uncontrolled factors are known as a chance. All are true regarding confounding in an epidemiological study except may simulate an association that does not exist, may increase or decrease the strength of association, may not reveal any association that does exist. All that is the true answer is always change in the direction of effect. The methods which you can use it to elevate the confounding during data analysis and epidemiological study is multivariate analysis. To reduce selection bias in a case control study, although all of the following are true except they use population-based design, apply different eligibility criteria for selecting cases and control. Both cases and controls undergo the same diagnostic procedure, avoid hospital-based design. Obtaining an accurate estimate of disease frequency and effective exposure of a health outcome in a study population pertains to internal validity. Blinding in an epidemiological study in a way to deal with the selection bias and information bias. Better recall of among the case in a case control study can result in information bias. The ability of a tool to correctly measure what it is supposed to measure is called validity. The bias may result the association with exposure and outcome among the study participant. A case control study was conducted to know the effect of smoking on lung cancer among hospitalized patients. The controls were recruited from patients admitted to the respiratory ward for other conditions. What type of bias will introduced? By virtue of recruiting a control from the hospital who are potentially different from the general purpose, that is selection bias. A researcher studied the effect of coffee drinking on myocardial infarction. The effect of coffee drinking on myocardial infarction was distorted because of the presence of a third factor, smoking. This phenomenon is called confounding. Which of the following method used to address for non-confounders as the designing study of a stage of a disease matching? A systematic distortion to the of the truth by the study object is a prevariation. The crude association in the presence of a confounder is the actual causal association false statement. Which of the following is the best method of ensuring that the experiment and control arm in an experiment study are similar with regard to known and unknown confounder at the planning stage is matching? And the study finding is generalizable to the target population, then it is called external valid. So the following can be introduced selection bias in a case control study. Inclusion of controls not representative of the target population. So the following is to avoid information bias in a cohort study. So the following is not a systematic error in an epidemiological random error. So the following measure is used to ensuring the internal validity of a study. Using a validated question to assess the outcome, including an adequate number of study participants, complying strictly with the study protocol. Which of the following is false about confounding in a epidemiological study? Confounding does not increase or decrease the strength of the association. That is a false statement. Systematic allocation of a data by an investigator supporting an unexpected conclusion and epidemiological study may result in a selection bias. Which of the following is not a method of dealing with the confounding during the designing stage? Stratification. A cohort study was conducted to examine the association between obesity and cardiovascular disease. During analysis, gender was suspected to be a confounder. So the following method will help to examine the confounding effect due to gender. Multivariate regression. Thank you.